friends, I'm Dr. MohammadThePharmacist. Thanks for watching. Now let's talk about Alp Tablet uses, side effects and price in Pakistan. Alp Tablet contains the active ingredient Alprazolam, which is a type of benzodiazepine. Alprazolam is primarily used for the short-term management of anxiety disorders, panic disorders, and anxiety associated with depression. So what is the mechanism of action of Alprazolam? Alp Tablet works by enhancing the effects of gamma-aminobutyric acid, a naturally occurring chemical in the brain that helps to calm down nerve activity. Alprazolam binds to specific sites on the GABA-A receptor, which increases the activity of GABA in the brain. This results in a decrease in excessive activity in the brain, which can reduce symptoms of anxiety, panic, and other related conditions. It is available in 4 strengths: 0.25 mg, 0.5 mg, 1 mg, and 2 mg. Alp 0.5 mg tablet price in Pakistan ranges between 6 and 8 rupees per tablet. The Alp tablet price varies depending on the strength and manufacturer. The Alp tablet uses include anxiety disorders. It can help reduce the symptoms of generalized anxiety disorder, social anxiety disorder, and other anxiety-related conditions. Panic disorder, it can be used to treat panic attacks, which are sudden episodes of intense fear or discomfort that may include physical symptoms such as sweating, racing heart, or shaking. Insomnia, Alp tablet may be prescribed for short-term treatment of insomnia, which is difficulty falling asleep or staying asleep. Muscle spasms, it may be used to treat muscle spasms and tremors caused by conditions such as multiple sclerosis or spinal cord injury. So how to take an Alp tablet? Swallow the tablet whole with a glass of water. Do not crush, chew, or break the tablet. It may be taken with or without, but it is essential to follow the guidelines provided by the doctor. Never take more than the prescribed dose or take the tablet more frequently than prescribed, as this can increase the risk of side effects or dependence. The usual starting dose for adults with anxiety is 0.25 milligrams to 0.5 milligrams taken 3 times per day. The maximum daily dose is usually around 4 milligrams. Some of the common side effects reported with the use of Alp tablet include drowsiness, dizziness, dry mouth, changes in appetite or weight, blurred vision, difficulty concentrating, memory problems, muscle weakness, slurred speech, impaired coordination, difficulty sleeping, etc. More serious side effects include allergic reactions such as hives, rash or swelling of the face, severe drowsiness or confusion, depression or suicidal thoughts, unusual changes in mood or behavior, hallucinations or delusions, jaundice, yellowing of the eyes or skin, seizures. If you experience any serious side effects, call your doctor immediately. Alp tablet 0.5 mg should be used with caution during pregnancy, as it belongs to a class of benzodiazepines which can cross the placenta and potentially harm the developing fetus. Studies have suggested that benzodiazepines may increase the risk of congenital malformations and developmental delays in the newborn, as well as cause withdrawal symptoms in the baby after birth. Long-term use of benzodiazepines during pregnancy may increase the risk of low birth weight, premature birth, and respiratory problems in the newborn. If you're already taking Alp tablet and become pregnant, do not stop taking the tablet without first consulting your gynecologist. Alp tablet can be effective for promoting sleep. It should only be used under the guidance of a doctor and for short-term treatment of insomnia. I hope you liked the video. Please like and share our channel. Subscribe to our channel. Thank you.